The Africa Christian Health Association's platform, ACHAP, is a networking, information sharing, experience sharing, and joint advocacy forum for the Christian health associations and church health networks and drug supply agencies run by the churches from various countries of sub-Saharan Africa. We have currently in membership about 26 such organizations from 21 different countries of Africa. And we are also exploring other countries that have not yet joined to see whether there are existing network of church health facilities or programs. They may be national, they may be just owned by one church or a couple of churches, just to come into the fellowship. The main purpose of the platform is to create one strong common voice on the church health work in Africa, its potential, its reach, the added value, as an opportunity for advocacy, telling the rest of the world what the faith-based are doing in health and the opportunities there are to expand that. The other aspect, of course, is to create a structure for us to engage with each other, visit each other, share information, share reports, share best practices, share challenges and how we address them, so that it's an opportunity for learning. The reason that the church health work is significant in sub-Saharan Africa is because it's a long-term commitment by the churches and built on a very solid foundation. We are finding that some of the church health work was started by missionaries over 100 years ago. In many countries, that's over 50 years before a government came into being. So the churches were pioneers in providing health services, education, and community empowerment through social programs. So you find where mission hospitals exist, you also have a school, for at various levels for empowering communities. You also probably have a medical training college because of the holistic approach in development. So those institutions have continued to provide services and to grow from strength to strength. The motivation then was never to help any government because there wasn't any. It was to serve communities who had need and who needed to be helped. And the churches were and continue to respond to the commissioning of Christ. So we feel we have a mandate that goes beyond government policy or funding or whatever. So we have a sustainable motivation. Church services will always be there, so therefore they have long-term commitment, and therefore, and even a source of inspiration and motivation why they should be there. Unlike sometimes the private sector, which is driven by business potential. Churches and religious communities exist within communities. And they have been there to meet the needs of the people. And they are there trying to meet their holistic needs, the spiritual, the physical, the emotional, including health needs. So they have a strong relationship with communities. There is a trust, with faith organizations, and therefore the institutions provided. You have to look at what are the foundations. You have a house of worship, which belongs to the entire community. Everybody comes there, for for worship, for spiritual activities. When there are problems in the community, through that fellowship, people are able to reach out and help each other. The same institution has a school for the children. That's where our children go to school. The same institution has a clinic or health facility. So there's a strong bond with the religious community and institution and services. And then, of course, they are established where they are because to make access to services to the people around there. They're created for the people to reach out. That's why you find faith-based institutions in places where it doesn't make any business sense. So remote, there are very few people living there, but there are people who have no access to any alternative service. So that's a unique motivation and purpose for being out there. And I said the leadership is trusted. I think we've had tremendous gains in building relations with other networks outside Africa. We have relations with organizations in Europe, networks of organizations like the Medicas Mundi. We've had close collaboration in the World Council of Churches, which gives us a bit of leverage in engaging UN agencies in Geneva. I've had membership and close interaction with the Christian Connections for International Health, CCIH in the US, which has been very instrumental in creating linkages with donor agencies and other partners in Washington and the US. So in the area of recognition and advocacy, we are getting now invited to sit in various international meetings and to bring a perspective from the faith-based. At our own level, we have had exchanges to help each other learn. We've had weak CHAs, get kind of twinned or begin have a relationship with stronger ones for mentorship, for learning, for encouragement, and you've seen great results there. We've had a fair amount of exchange in terms of learning how to relate with governments, how to strengthen collaboration and relationship. I can, for example, give an example of Kenya where we never had any written understanding in our relationship with government. And we went out to learn from other countries. We sent a team, a delegation, which included government representatives, the faith-based organizations, the NGOs, and development partners, and we went, and Chuck coordinated this. We went to Ghana. They spent 5 days there. Another team went to Uganda. Another team went to Tanzania, Malawi, and Zambia, and we gained tremendous lessons, including, getting documents from both government and the faith-based on memorandum of understanding with government and how it works. We came back and we were able to get inspired and get convinced that we can do it. And we led the way in developing an MOU with government, which was, we managed to advocate to have it accepted and signed. So that's a key lesson. The countries of Malawi and Zambia have made a couple of visits to Kenya to learn about how we established and how we manage a drug supply agency. Kenya is a very successful drug supply agency which deals with supply chain management, coordination for essential drugs and supplies, in short, meds. And through they are coming to see how it's established, how it operates. Zambia has also established its own warehouse, and they're having a procurement and distribution service now, and a big warehouse in Zambia, Lusaka, Zambia. Malawi is also in the process. They have started in a small way. Kenya has been working on strengthening hospital management. And one key intervention we decided to work on is develop a software to assist hospitals in managing patient records, inventory of drugs and other supplies used, and revenue generated from services, to ensure accuracy, to ensure timely and accurate information to support decision making. So ACHAP has developed a software. It's actually been built on an open source system that's available on the internet, customized it and improved it, and we are using it in hospital management. So through the IMA World Health, a team from Democratic Republic of Congo has come, and with the support of IMA, they have picked what ACHAP has been able to develop and is using, and we have an agreement that they'll go and translate it into French and continue development on their end. So it's a partnership here between ACHAP, IMA, and the church in DRC. We treat diseases the way ministries of health guide that we should. We also use experts. We have well-trained health workers, whether they are local or whether they are expatriates, and they do the best possible quality job that is feasible. And we are very open to building relations, not just within our faith, but to other partners who share in the same vision and mission of helping us to extend our services, quality healthcare services, which follow national policies and professional ethics to the wider community. Thank you.